I've asked you to watch this film about Dupuytren's contracture because we've decided to go ahead with an operation to remove the contracture from the palm of your hand. This is in order to improve the extension of your fingers and improve the function generally. It's important you understand some of the risks involved with the surgery and what the procedure will involve. Performing surgery to remove a Dupuytren's contracture is usually very straightforward, but is associated with standard complications and standard risks as with all surgery. The first risk with all surgery is always infection, and we'll be doing everything we can to prevent that. Fortunately, in Dupuytren surgery, the risk of infection is very low at around 2 to 3%. If you have any other problems with the surgery, it's likely to be some altered sensation down one border or the other of the finger. Excising a Dupuytren's cord is very close to the nerve, so we'll be very careful to make sure that the nerves aren't injured during the surgery. The risk of nerve injury is about 1 or 2%. Tendon injury is extremely uncommon, and it's likely that you'll be able to have normal function in your finger afterwards. The commonest risk of Dupuytren surgery is that the Dupuytren's cord either recurs quite early, and the recurrence rates are about 20% at 5 years following this surgery. Some patients will have incomplete extension of their finger following the surgery, and other patients will have difficulty in flexing, and the scar may be thickened. So it's very important that you attend for your hand therapy following the Dupuytren's contracture surgery. We usually arrange a hand therapy appointment after Dupuytren's contracture surgery at around 2 weeks, which is when the stitches are due to come out and when the bandages first come off. After Dupuytren's contracture release, when you wake up after the surgery, you'll have a bulky bandage around the hand which will be holding the fingers in an extended position, in the best position that we could achieve at the time of the surgery. It's best to leave this dressing in place for 2 weeks until the hand therapist takes it down, and then we can clean the wound, take the stitches out, and then apply a thermoplastic splint to hold it in that position, which you may need to wear for up to 3 months after the surgery, most often at night. You'd often need to see a hand therapist on a weekly basis following Dupuytren's contracture release, and this usually involves about an hour of work with the hand therapist, working through range and swelling, and they sometimes use a pulsatile ultrasound device to try to massage the scar and reduce the swelling in the scar. When you come in to have a Dupuytren's contracture release, this will usually be done under either general anaesthetic or a regional block. The anaesthetist will talk to you before the surgery about what to expect, and if you're going to have a regional block, the anaesthetist will tell you where they're going to be putting the needles, either in your neck or in your armpit, and then there'll be a 5 or 10 minute period in the anaesthetic room while this procedure is done, and then the arm will go numb. If you have a regional block, you'll then need to carry your arm around for 24-48 hours until the full power and the feeling comes back in your arm. Most of these procedures, however, are done under general anaesthetic, and following a general anaesthetic, we'd like you to have an escort to go home. We'd like you to keep your hand elevated for 24-48 hours. And if the operation is done late in the day, these operations can often be fairly lengthy. It usually takes about 45 minutes per finger. So if you had a long anaesthetic during the day, you may need to stay overnight and go home the next day. When you go home, we'd like you to keep the hand elevated and begin your exercises on the other fingers. So the fingers that aren't immobilized in the splint, we'd like you to get those moving as quickly as possible so that they don't become stiff. And usually after Dupuytren surgery, you can expect to return to work after the 2-week appointment when the thermoplastic splint has been removed, if your job would allow you to do that. If you can't work with a splint on your hand, then of course you'll have to remain off work until the splints are no longer necessary, which may be 4 to 6 weeks after the surgery. If you have any concerns about your dressings, swelling in your hand or pain, then you should call my secretary or contact the ward, and we'd be happy to see you urgently if necessary, or have a telephone conversation, or you could even send us an email if that seems to be helpful.